Hi, this is Dr. Tiffany Jackson, naturopathic doctor at Natural Medicine Now University. Thank you for joining us for this webinar on heart health. Every year you hear of some new magic pill or surgical technique to cure heart problems. And each and every year, heart disease is the leading cause of death. Most doctors have been taught that the cause of heart disease is due to smoking, weight problems, high cholesterol, high blood pressure, and just plain genetic bad luck. But new research is discovering that systemic inflammation and free radicals and omega-6 fatty acids and high homocysteine levels play a fundamental role in the onset of heart disease. In this webinar, I've invited a special guest, Dr. Chris Nagy, to teach you how to have a healthy heart. Dr. Nagy is not only an orthopedic surgeon for 25 years, but he's also furthered his training as a fellow in the American Academy of Anti-Aging Medicine, and he completed a certification in age management medicine. Dr. Nagy is a man on a mission to educate people who want better health for themselves beyond what modern medicine offers. In this webinar, you will learn specific heart-healthy nutrients and diet suggestions, along with specialized laboratory testing to help you prevent heart disease. So let's get started. Hey, Dr. Nagy, thank you so much for being here and joining me for this Natural Medicine Now webinar on heart health. How are you?
I'm doing great. How are you doing?
Wonderful. I really appreciate you taking time out to educate our listeners on the importance of heart disease. Why don't you just go ahead and tell us your experience of working with patients? And I know you're passionate about a healthy heart diet and taking specific supplements that you're going to teach us about. But go ahead and just tell us a little bit about your experience of working with patients and what you think you can teach us today.
Well, my whole oversight in working with patients is trying to address the whole system, but certainly cardiac and cardiovascular health is of paramount importance. As the number one killer in America, that's on many people's minds. Many people fear cancer and the treatments for it, but heart disease sometimes receives a back seat when in fact it's a huge, huge problem in America, particularly the American diet. So what I try to do in general is kind of guide people on principles of optimal health that's going to address all the organs, but specifically the cardiovascular system as well as the brain or the neurologic system. Because many of the things that you do to promote optimal health are not just going to help one system in isolation. They'll help everything. So a lot of the principles I think we're going to talk about today, though specifically we're talking about the heart, will be things that I think we all need to consider for improving our overall health, actually. So I'm not a cardiologist. I don't focus specifically and only on the heart, but a lot of the things that I try to teach people to improve their health are things that, while improving the heart, should improve everything else about your health, too.
Great. Well, let's go ahead and just talk about the anatomy of the heart. Can you give us just an overview and maybe some basic principles of how the heart works?
Oh, sure. And, what's not frequently considered commonly when you look at the anatomy of the heart is actually a muscle. It's a four-chambered muscle that helps circulate blood throughout the whole system. And the neat thing about the heart is it has its own little electrical system. That's how we're able to obtain an EKG or do some studying of the heart. So the heart it's a hard-working organ, probably one of the hardest working organs in the body next to the brain. But it's a four-chambered muscle, has an electrical system, and some of the things that it does, I'll run off a little quick facts for you about what the heart actually does as far as its workload. The average heart's about the size of your fist. Generally weighs between 7 and 15 ounces. That's the typical weight of a healthy heart. And, with each individual beat, as the heart expands and contracts, it really just sends out about 2 to 3 ounces of blood. Not a whole lot with each individual pump, but cumulatively, over a minute, over an hour, over a lifetime, it sends out, it works extremely hard. So it's an organ that requires a significant amount of energy to function properly. To pump the blood all through the body from the heart and lungs, it takes really just about a minute to run all the way through the body. And in that same minute, your heart's going to be pumping approximately 1.3 gallons of blood. Over the course of the day, as far as heartbeats are concerned, we're talking about 100,000 heartbeats over the course of the day, shuttling some 2,000 gallons of oxygen-rich blood throughout the body. And since we're talking about counting heartbeats, 100,000 heartbeats a day, that adds up to about 35 million heartbeats a year, which is incredibly about 2.5 to 3.5 billion beats in a lifetime. So it's a pretty amazing organ, and it needs to be treated properly so that it can maintain its health and function well throughout an individual's lifetime. I mentioned earlier, it's a muscle, but it's a very, very specialized muscle, more so than what we typically think of muscles in the body.
Yeah, I remember hearing a statistic one time that the heart pumps approximately 700,000 gallons a year of blood. Which,
it's incredible.
Put that into perspective. It's got a pretty significant job. So tell us about, the heart as a muscle. What nutrients does the heart need to function optimally?
Well, that's a great question, because without the nutrients that it needs, it's not going to function in its optimal state. And there's a number of specific nutrients that are very helpful to the heart. A big one is magnesium. Magnesium works in the body. It's involved in over 325 different cellular reactions, but specifically for the heart, the magnesium helps control muscle contraction, helps control electrical impulses in circuits. So a huge beneficial nutrient for the heart is magnesium. Another nutrient that's very important for the heart is what's called CoQ10. It's what the muscle cells use as a source of energy. And CoQ10, you may see that as a supplement at the health food store. If you wanted to actually consume CoQ10 via your diet, the most nutrient-dense form of CoQ10 is actually eating the heart. Now, that's not an organ we typically would eat, but if you wanted to eat your way into an abundant amount of CoQ10, you would have to eat hearts, basically, because that's where the most CoQ10 is concentrated. So that's another nutrient important for the heart. Omega-3 fatty acids are another component that's very healthy for the heart. They're anti-inflammatory acids. They can sometimes help regulate the heart rhythm a little bit. And so omega-3s are another heart-healthy nutrient. I'm also a big fan of vitamin K2. We hear a lot about vitamin D and calcium, but in all honesty, I think the next up-and-coming vitamin that's going to receive a lot more attention is vitamin K2, because what K2 is calcium's tour guide in the body. So what K2 does is it takes calcium from the anywhere it is in the body and plants it in the bones and keeps it out of the soft tissues. So if one is deficient in vitamin K2, they run the risk of developing coronary artery calcification, soft tissue calcification. So K2 is a big one of which a lot of people aren't extremely familiar with, like they are some of the other vitamins, particularly vitamin D. And actually, if you're taking vitamin D, it upregulates the production of vitamin K2 dependent proteins. So if you're not getting an adequate source of K2, you're at risk for soft tissue calcification, coronary artery calcification. Another nutrient that's very good for the heart is what's called L-carnitine. And what L-carnitine does is it transfers fatty acids into the cells so that those fatty acids can be used as energy. And since we're talking about nutrients here a little bit, Dr. Steven Sinatra, he's a cardiologist, he has a little formula that he calls the awesome foursome, which are nutrients that he recommends for people that have congestive heart failure or have energy deficiency or heart issues. And the awesome foursome is L-carnitine, magnesium, CoQ10, and D-ribose. And D-ribose is the backbone structure of ATP, which is an energy creator within the heart itself. So those are just some of the nutrients. There are many others. B vitamins are very important for the heart because they lower the level of a substrate called homocysteine, which can cause heart damage. So that doesn't cover all the nutrients, but many of those that I just mentioned are very important for optimizing your heart health.
What do you recommend about taking fish oils, and do you believe they're heart protective?
I do. There's studies out demonstrating the benefit, and other studies saying that they're not that beneficial at all. But the fish oils, particularly, are what are called omega-3 oils, and they are anti-inflammatory in nature. If you look at fish oil versus other types of oil, vegetable oils, those are what are called omega-6 oils, and those are inflammatory. So fish oil or omega-3 oils are anti-inflammatory. Omega-6s are inflammatory. And unfortunately, predominantly, most of the oils that we consume in our standard American diet are the omega-6s. So it used to be a ratio, millions of years ago, of maybe 1-to-1, 2-to-1, omega-6 to omega-3. Currently, it's estimated to be approximately 20-to-1, omega-6 to omega-3, which is hugely inflammatory. So I think it's worthwhile to take omega-3 oils as an anti-inflammatory and to balance that omega-6 omega-3 ratio. Again, there has been some information that omega-3s also help stabilize the rhythm of the heart, as does magnesium. So may help prevent going into an arrhythmia or a dysrhythmia, a negative function. So I'm a big fan of omega-3 oils for the heart, fish oil particularly. Some people can't take fish oil, and flax oil is sometimes recommended as an omega-3, but unfortunately the human body is not good at converting a lot of the omega-3s in flaxseed oil to the effective omega-3s that are more protective of the heart that are found in fish oil.
Well, you had mentioned about fish oils being anti-inflammatory. So what does that mean, being inflammatory, and how would decreased inflammation help with preventing heart disease?
Well, another great question. Inflammation really is the root cause of most disease. I often tell people, if you want to lead a long, healthy life, control your insulin levels and control your inflammation levels, because inflammation wreaks all kinds of havoc throughout the body. And inflammation is the root cause of most chronic disease that we experience these days. And inflammation is caused, you think of inflammation as an infection or a cut, and that is part of the inflammatory process. But due to a lot of the things that we standardly consume in our American diet, all of these things can lead to inflammation within the body. Things such as trans fats, endocrine disrupting chemicals, phthalates, smoking, stress, all of these increase generalized inflammation. And when you have increased inflammation, it sets off an immune reaction, which then, depending on the level of inflammation you have, can do tissue damage, and not just to the heart, but really throughout the entire system. So inflammation is a huge component, and finally science is coming around to recognizing that and actually doing something about it. So leading an anti-inflammatory lifestyle via the food you eat, the way you handle your stress, how you deal in your day-to-day life is a huge component of staying healthy, not just for the heart, but for the whole body.
Well, that leads me into my next question. So what kind of diet do you recommend to prevent heart disease?
Well, first and foremost, a whole foods-based diet, restricting processed simple carbs and simple sugars primarily. You want to consume a diet that's high in plant food. Meat is fine as long as it's properly sourced meat and not in excess. Michael Pollan, the author, wrote, eat food, mostly plants, not too much. And I think that's a good recommendation, a simple recommendation for a heart-healthy diet. I don't think we need to shun and avoid fat as we have so significantly over the past 50 to 60 years, because the recent medical research is demonstrating that fat's not the demon here. And I'm speaking of natural fats, natural plant, natural animal fats, not trans fats, which are man-made hydrogenated fats, because those are harmful and cause a lot of havoc within the body. So a Mediterranean diet and staying away from simple processed refined carbohydrates and sugars is, I believe, the ultimate diet to maintain and improve heart health as well as human health.
Great. Can you give us some examples of a healthy breakfast and lunch and dinner?
Oh, sure. And again, it's all based on a whole foods model. I'm more of an advocate for breakfast of some eggs, some appropriately sourced sausage or bacon, maybe a quiche with some vegetables in it. That's a great way to start the day versus pouring a bowl full of sugar, which is cereal, and then pouring sugar water over it, which is skim milk. All of us think Special K is healthy, but in fact, if you break it down, it's mostly just sugar, and then you're pouring more sugar over it. For lunch, I'll generally recommend a salad with a healthy source of protein, and use some olive oil over the salad, some balsamic vinegar. Olive oil specifically is a very healthy form of fat to use. So that's generally what I would typically recommend for lunch. For dinner, more vegetables, more plant foods, an adequate source of protein, whether it be chicken or steak or seafood. Salmon would be great. But basically, plant foods, some protein, stay away from the refined carbohydrates, and healthy fats. And there's many variables. It's too much to try to get into as far as recipes on this type of a talk. But basically, a diet that's as close to nature as possible.
So just explain for a minute, why are carbohydrates so bad and damaging to the heart and cardiovascular system specifically?
Well, carbohydrates, basically, once they pass the tongue, they get turned into sugar. And the body can only handle so much sugar. And unfortunately, our diet in America these days is primarily carbohydrate driven. So what happens when you eat the sugar, it goes into your bloodstream, your body can only tolerate so much of it and wants to do whatever it can to get it out of the bloodstream. And so that so insulin levels go up. Insulin's the hormone that helps regulate blood sugar, but insulin also does many other things, many of which are harmful. Too much insulin is harmful to an individual. So what happens with all the sugar, that's the sugar rush that you get from eating excess carbs, that can lead to inflammation in the body. Insulin is a pro-inflammatory hormone. Inflammation, as we discussed a little bit earlier, can then cause damage to the lining of the blood vessels, what's called the endothelial lining. And if it does damage the endothelial lining, then white blood cells, macrophages, and such come in and try to heal the damage, and that's what creates a plaque. So repeated assaults from excess carbohydrates can lead to further problems and proliferation of arterial injury down the road, essentially.
So how does cholesterol play into this?
Well, if you have damage to the endothelial lining or the lining of the blood vessels, cholesterol really is just doing its job. It goes in to help repair and heal over the area where the endothelium or the blood vessel lining is injured or damaged. Cholesterol and the importance of cholesterol in heart disease is way overblown. And that's becoming more and more evident with the passage of time. So some people say cholesterol it's found at the scene, but it's not the guilty party. It'd be the same analogy as blaming firemen for the fire that they're fighting just because they happen to be there. Cholesterol is only doing its job and responding to the body's biology by being at the scene because it has a role in repairing the damage that's done from inflammation to the arterial lining. So cholesterol, if your concerns are that cholesterol is the root cause of heart disease, you would be wrong. And unfortunately, most of modern medicine demonizes and villainizes cholesterol as if it is the primary cause of heart disease, and it is not. 50% of people or more who have a heart attack have normal cholesterol levels, and there are many populations with high cholesterol levels that have a lower rate of heart attacks than we do in the United States, and there are other countries that have low cholesterol levels that have a higher heart attack rate. So using cholesterol as an indicator for the prognosis for heart disease or the risk of heart disease is not an accurate measurement.
So what labs do you recommend testing to have done to see if your heart is at risk?
That's, I think, one of the downfalls of modern medicine. We put such focus on cholesterol. What's my cholesterol? Everybody knows what their cholesterol is. That's been beaten into our heads over these years. But there are a number of labs, I think, that are very important for people to be aware of if their goal is to optimize and improve their health. So the labs that I generally recommend to gauge one's heart health is what's called a cardiac CRP, or highly sensitive CRP. And the CRP is C-reactive protein. Generally, the cardiac CRP is the most sensitive measure of inflammation in the body. And as we discussed earlier, inflammation is the root cause of heart disease and many diseases. So you want your cardiac CRP to be as low as possible. So that's one test I recommend. I also recommend a homocysteine level. Homocysteine is an inflammatory unit that the higher your homocysteine is, the higher your risk of heart disease, dementia, many problems. And a homocysteine level is a reflection of how well your B vitamin status is. I also recommend that people have a fasting insulin performed. We look at diabetes and we're always gauging the glucose, but as long as the pancreas is working, it will keep the glucose level at a normal level. What we don't look at, I think, frequently enough is the insulin level, because the insulin level will go higher and higher and higher and higher to keep glucose or sugar under control until the pancreas then just poops out, and then boom, you got diabetes. So I think it's important to check a fasting insulin level as a measure of general health. Of course, a hemoglobin A1C, that's a measure of how your sugar levels or glucose levels have been over the past 2 to 3 months. And one other test that I think is good to know for general health is a ferritin level. And a ferritin level is a level checking your long-term iron storage, because iron itself can, the easiest way to understand it is excess iron can cause internal rusting in the body and is correlated with heart disease or heart attacks. So the tests that I generally recommend are a cardiac CRP, a homocysteine level, a fasting insulin level, a hemoglobin A1C, and a ferritin level. Many of those are labs that are not routinely performed, but I believe should be if your goal is to achieve optimal health and see where your actual true risk is for heart disease.
So if there was a listener out there that has been diagnosed with, some cardiac heart failure, or, maybe they've had a high risk for stroke or high blood pressure, or they have, some sort of heart-related disease going on, do you believe that it can be reversed?
Well, it can, given the proper circumstances. And there's been some evidence of reversal of heart disease using particular diets, too. So it can't be reversed to give you a brand new, younger heart, but there are plenty of things that you can do to optimize your heart function via diet, Dr. Sinatra's awesome foursome that we talked about, as well as dealing with your stress. I mean, it can't be reversed completely, and it may have been diagnosed at the point that it's too far to reverse it slowly. But if it's not a critical form of heart disease, there's no rush to race in and have a quadruple bypass. And you have to attend to your lifestyle measures first, even if you have an invasive treatment. So there is some hope for the reversal of heart disease, but you have to address all the issues underlying what brought you there in the first place.
So, Dr. Nagy, can you give us some optimal ranges for those labs that our listeners should aim to be in?
Oh, absolutely. And, that's a good question. And plus your use of the term optimal. There's the normal range and then there's the optimal. And I'm kind of an optimal, the the better you can get it, the better, basically. So optimal for cardiac CRP basically should be less than 1, as low as possible. But you'd like your cardiac CRP to be less than 1. For homocysteine, certainly you'd like that to be under 10, 7 or 8 if you can. You don't want to be down to 2 or 3 or something like that, but you certainly don't want it to be over 10. A fasting insulin level, less than 5 would be a good range, preferably 2 or less than 2 even. An A1C, if you can keep your hemoglobin A1C between 5, 5.5, you're doing well. As far as a ferritin level, basically 75 to 100 is a reasonable ferritin level. If you start getting higher than that, then that can cause some oxidation because of the iron content. Now, some labs I didn't mention, which are routine labs, because I was speaking to more specialized labs here. Fasting glucose, certainly you want to keep that under 85 if possible. Triglycerides, which are receiving more attention finally as a risk factor for heart disease, you'd like to keep your triglycerides below 100. And when you're looking at cholesterol, the good cholesterol, which they talk about as HDL, you'd like that to be over 60 for men and over 70 for women. There are some different ratios between triglycerides and HDL too, but I won't delve into that too deeply. And traditionally, the numbers are that your total cholesterol should be less than 200. Total cholesterol is a very poor marker for cardiac risk, and there's no science behind saying that it should be under 200. The results that determined that the cholesterol should be under 200 was made up by 9 people sitting around a desk talking about what they think the low rate should be. And, unfortunately, 8 of those 9 scientists or researchers were on the payroll of the pharmaceutical companies. So if your cholesterol is 207 and your doctor says, I don't know, we got to get it lower, put you on a statin, I would question that. As long as your cholesterol is not, in my opinion, under 160 or over 350, it doesn't require being medicated. So, again, cholesterol, in light of all the other labs that we talked about, is not the only factor that you should consider as far as heart health.
Yeah, it's quite interesting because if you do get cholesterol down too low, it can be very damaging to the brain, and people can't think, and memory loss. Do you have any comments about that with what some of these medications are?
Absolutely. Yes, you're exactly right. If you get your cholesterol levels too low, you stop making hormones, vitamin D, testosterone, estrogen. Those are made of cholesterol. 60% of the dry weight of your brain is cholesterol. So you get your cholesterol too low, and you start to run risks for many, many problems, which are often not acknowledged as they should be. Cholesterol is a vital nutrient in the body. So to just dismiss it and get rid of it and try to knock it as low as possible is damaging and harmful overall. So I'm not an advocate of draining your cholesterol levels to nothing. And there are some studies that show the lower your cholesterol, the more likely you will die of some type of a violent death. So cholesterol is a vital nutrient for overall health. Your brain needs it, the insulating sheaths for your nerves need it, and every cell membrane needs cholesterol. So to just dismiss it and knock it out as if it's useless and a heart attack creating substance is completely wrong.
So you said the optimal range for somebody's total cholesterol, you said you wouldn't get it below 160?
Well, it's stated that if you drop it less than 140, that you stop making hormones, including vitamin D. I've also seen that quoted at 160. So I would be a little reluctant or concerned if I see someone's total cholesterol at less than 160, really.
Well, Dr. Nagy, go ahead and give us 3 action plans you would recommend for people listening that they could actually start today just to help make their heart healthier and help prevent heart disease.
Certainly. And the first thing on that action plan is diet. The diet underlies everything about what happens to us in health, sickness, or disease. So if you can clean up your diet, get rid of the processed carbs and sugars, trans fats, basically convert as best possible to a whole foods-based diet, the better off you're going to be. So diet is hugely important, and that's where it starts, and that underlies everything. Number two is to have some type of physical activity, exercise. As I mentioned earlier, and we talked about, the heart is a muscle. Muscles respond to exercise in a positive fashion. So exercise to help strengthen and improve the function of the heart is extremely effective. And number three is stress reduction. That's something that may seem mystical to people and out there, but definitely things such as meditation, yoga, taking a hard look in the mirror and figuring out where you're failing in your life and what you're going to do about it will go a long way towards improving your heart health. Because, again, we talked about the heart being a muscle, but it also has an electrical system, and that electrical system is influenced by the way you handle your stress in your day-to-day life and activities. So work on the diet and get involved in some exercise. Don't kill yourself, but do something that requires some physical exertion, and deal and address with your stress in a positive fashion. All those three things are things I think many people know, but now we just have to start doing. Sometimes it's not a lack of knowing, it's a lack of doing, and paying attention to the little things will make a huge difference in the long run.
Thank you, Dr. Nagy, for being here and sharing this heart-healthy information.
Well, I'm happy to be here. Anything I can do to help empower people to improve their health. I always tell my patients, you can't medicate your way to health. It's the lifestyle and the diet and everything that's involved that's going to either make you healthy or keep you sick. So I'm happy to share any information I have to help make the world a better place.
Well, that is our mission too here at Natural Medicine Now University, just to empower people and give them the right tools and education so they can implement these healthy changes into their life. So thank you for being a part of Natural Medicine Now University. Dr. Nagy, you have a great day.
You too.
Thank you for joining this webinar. I hope you now have a better understanding of how to keep your heart healthy to prevent heart disease. For more information on products discussed in this webinar, visit our website, naturalmedicinenow.com. So take action and prevent disease. This is Dr. Tiffany Jackson wishing you a happy and healthy day.